Welcome to Digital Retinal Imaging. Today we're going to show you how to use the digital retinal imaging software in your routine visit as a screening tool for your patients. And I've already preloaded on the screen which you see the patient's images. This is the right eye and this is the left eye. I'm going to show you exactly how I would talk to the patient about it. And in this case, we're going to mark things on this picture for display that are not actually there, just so I can show you what the tools do. Because this patient happens to be pretty healthy, other than for some small drusen. Now, one of the things you'll notice that if you look at this picture, you don't see drusen. If you look with your handheld instrument, you'll see pretty much this. So you won't see drusen. But this is the advantage of using the digital retinal imager. I'm going to select this tool here. I'm going to click on the photo. It says right image selected, yes. And now we're going to enhance the image inside the patient. Mr. Patient, here you are looking at an enhanced view of the inside of your right eye. It's about 1.5 inches inside your head. These are dark vessels, veins. The light ones are arteries. As we scroll down here, you can see the optic nerve, largest nerve in your body, nice and healthy, no signs of glaucoma. By looking at your blood vessels where they cross, we can see indications of whether or not you might have hardened the arteries. You don't show me. There's also no evidence of diabetes. Now, looking at the center of your vision here, there are a few little white dots here and some on the periphery, and these probably represent drusen, and drusen may indicate a tendency to have your vision deteriorate as you get much older. And this is a wonderful opportunity for us to talk about how you can prevent these little drusen from becoming an issue in the future. So I'm glad you decided to take this test. Now, let's say the person had in fact had hardening the arteries. One of the things I could do is mark it. So I'd go over to a blood vessel crossing like here, and if it showed hardening the arteries, I'd mark it and tell the patient about it. Now we're going to save this. Save changes, yes. And you can appear right there, and it shows the patient where the problem is with the artery. So now, the next thing I'm going to do is I'm going to look up a description of the problem, and I'm going to load it. And there it is. I don't type anything over and over again. This program does things fast. Now, I have a treatment program for blood vessel problems. We practice holistically. So I'm going to talk to the patient about that, and I'm going to give them written instructions. Because the way we look at it is whatever is in the eyes is in the body, and this is a holistic approach. Not that I'm going to try and become their medical doctor, because I won't. The text here tells you what's wrong, what we found, and down here it tells them things to do. It gives them a starting program. It talks about exercise, diet, supplements, learn by going online, and I give them a hyperlink. If you smoke, stop smoking, and consult with your medical doctor. I'll also send the medical doctor a report, so when they come, the doctor will know why they're coming. Now, if they had a normal eye, let's say this one was normal, I'd go up here to this box, select normal, and load the information, and there it is. It says this is a normal retina. There is good blood vessel color, size, and flexibility. Optic nerve has a normal shape and color. You can put any text in here and save it and use your text over and over. You'll find there are several diagnoses you'll use, and as a result, you'll be able to draw them out of the database in seconds, and you're done. This is a sample of hardening the arteries. This is a sample of diabetes, because people frequently ask us about that, and we frequently find these things. So we give them a reference point. Now, at that point, we're done. In my office, this will take about 1.5 minutes. And then I'm going to print the report for the patient. Okay? So I'll hit OK. And you'll notice something. Let me get this out of the way, the print dialog box. You see now this is a document that's going to be printed exactly as you see it. No more buttons, no more controls. Just a picture of the patient's retina, the diagnosis and treatment program, and a place for you to write in the diagnosis. Excuse me, the patient's name. Patient's name can also be loaded from the database. In this particular case, I didn't do that. Now I'm going to cancel because I'm not going to actually print this. And you see the buttons are back. Pretty neat trick, huh? Anyway, so in just a few moments, we've looked at patients' health through their eyes. We've looked at their eye health. We can tell them about drusen, how to prevent macular degeneration in the future, and they are going to love you. You're going to print a copy of this while you do the rest of your exam, so it takes no waiting time. And then you're going to put 2 copies, one for the patient in the vision report, which you should be giving them, and one for yourself. And with this report, they're going to go home, show it to their friends and family, and tell them what an incredible doctor you are, because you are, and you do deserve that recognition. Now, very briefly, I'm going to show you something else. I'm going to open. This part of the program will show you how to write a report that'll gain you recognition. But this is a report I created for a patient likes one, and you'll see that there's information about Here's a picture of the blood vessel that had hardened the arteries. Here's my report. And this is going to go to their doctor. When I print it, it's going to have a full color image, often both the left and right eyes, and my information to the patient and recommendation to the doctor. If you follow this and you send reports to the doctor and you give the patient the information that they need, guess what? You're going to see very significant growth in your practice, and you're going to be providing a great service. This is what digital retinal imaging is all about. It takes just a few moments. It utilizes the tools you may already have in your office. I hope you have a digital camera. If not, you need one. And get one, because the program paid for it in 6 months. After we started using the program, people were so enthusiastic, they were pouring through the door, and we charged a nominal fee of $35, and in 6 months we paid off the retinal camera, and ever since then this has made us a very nice profit and helped build our practice. We're talking $50,000 per lane with no real effort. Think about that. Provide the best of care for your patients. Have a tool that will report to the doctors in the community the kind of work you're doing. It'll market you to your patients. Your patients will market you to their friends. And it's all because you're providing great care with simple office tools in your office and doing it profitably.